Hi, I want to dedicate this video to answering some of your most frequently asked questions about COVID-19 vaccines, which are: can you get COVID-19 after getting one or even both doses of a vaccine? Are you just as infectious? Many of you ask, what is even the point of getting a vaccine if you can still fall sick? The short answer is yes. Yes, you can test positive for COVID-19 after you are vaccinated. These are called breakthrough cases, defined as someone getting COVID 2 weeks after they receive a shot. 2 weeks is the average time it takes for your immune system to produce neutralizing antibodies, which in the future fight off the coronavirus if and when it encounters it. This is crucial to understand. The primary goal of getting a vaccine is not to eliminate the coronavirus. It is to teach your immune system to fight it off quickly and effectively if you get infected. In a sense, weaken the virus. When enough people's immune systems can do this, the weakened virus stops spreading as fast and as much. But to eliminate or completely eradicate the virus requires very high levels of herd immunity over a prolonged period of time. For some perspective, to date only smallpox has been eradicated, or for instance polio. Although high coverage with oral polio vaccine has eliminated type 2 poliovirus globally, transmission of types 1 and 3 continues in limited areas in a few countries, including India, for which vaccinations also continue. The thing to remember is no vaccine currently in circulation for any disease is 100% effective. In the case of COVID-19, Moderna's vaccine is 94.1% effective. Pfizer's vaccine is 95% effective. The Johnson & Johnson vaccine is 100% effective at preventing COVID-19 hospitalization and death, 85% effective at preventing severe COVID-19 cases, and 72% effective at preventing moderate illness. The AstraZeneca vaccine, sold as Covishield in India, is 79% effective at preventing symptomatic COVID-19. We're still waiting on final data from phase 3 trials of Covaxin, but interim data previously suggested that it is around 80% effective in preventing symptomatic COVID-19, which means the virus can still transmit into your body and you will still test positive, but you will most likely be asymptomatic or have mild symptoms. All this to say, even if a vaccine fails to protect against infection and results in a breakthrough case, it often protects against serious disease and death. By now we have thousands of breakthrough cases globally, and quite a few in India as well, including former Prime Minister Manmohan Singh, who received both doses of a vaccine and still tested positive for COVID-19 on April 19th. Understandably, this has caused some concern. India does not have a centralized inventory of how many vaccinated Indians were reinfected, whether it was after their first shot or second shot, whether it happened during the 2-week window or after, or how severe the disease was, etc. The global expert consensus is that if you get a vaccine and then get infected, there is a very small chance of the disease manifesting beyond mild symptoms. There is also a high chance that you will be less infectious. Your body will fight off the virus fast and effectively enough to neutralize it before it can escape your system and spread. According to the latest US CDC data on breakthrough cases, among more than 75 million fully vaccinated people in the US, around 5,800 people tested positive for COVID-19. Now, this means that 99.992% of those vaccinated have not contracted COVID-19 after getting their shots. From among the 0.008% who got infected, 29% were asymptomatic. 7% of the 5,800 cases resulted in hospitalization. To put it another way, only 0.0005% of vaccinated people who got infected showed severe symptoms. There were 74 deaths, which is a death rate of around 1% among breakthrough cases. Or to put it another way, 0.0001% of fully vaccinated people died. Now, for some perspective, the WHO says that 3.4% of all unvaccinated people who get COVID-19 have been dying. 0.0001% with vaccines, 3.4% without vaccines. Which brings me back to my original point. The primary goal of COVID-19 vaccines is to prevent serious illness and death, which every single vaccine till now, whether in India or abroad, has largely done. Now, why these breakthrough cases occur in the first place is another question I often get. Experts say that vaccines fail in some people because of a variety of factors, including immune status, health status, age, and the medications they're on. There's also the possibility that something went wrong with the vaccines themselves, such as improper storage, delivery, or even composition. And then there's the new variants. Recent evidence from UK suggests that both the Pfizer and AstraZeneca vaccines provide significant protection against severe disease and hospitalizations from the highly transmissible UK variant. On the other hand, the South Africa variant does seem to reduce the efficacy of the AstraZeneca vaccine, but experts say it is still efficient enough. Data for India's double variant is still a work in progress. So we don't know exactly how much it affects the vaccines, but experts say there is no reason to believe that the vaccines won't do what they're supposed to do, which is protect you from falling severely ill or dying if you test positive for COVID-19. To your questions about how infectious someone can be if they test positive after getting vaccinated, the best answer is studies are still underway to determine whether shots can also stop people from passing on the virus. But all signs point to the fact that you will likely be less infectious after a vaccine than without it. For instance, the Oxford AstraZeneca clinical trial observed a larger reduction in viral load in a small group of vaccinated participants than in the unvaccinated group. Or take Israel, where nearly 60% of the population has received both doses of a COVID vaccine. New cases peaked in January 2021 and have been falling sharply since then. One study looking at breakthrough cases in Israel observed that people who tested positive 2 to 4 weeks after receiving their first dose of the Pfizer vaccine had fewer viral particles in their system compared to those who caught the virus in the first 2 weeks after the injection. Experts say that the data is clearly suggestive that vaccination may also reduce the infectiousness of COVID-19 patients, in addition to preventing severe symptoms and death. But they need more time to give us definitive, conclusive answers. So, till then, they advise, once vaccinated, you should continue following health precautions for now, such as wearing a mask, staying at least 6 feet apart from others, avoiding crowds and poorly ventilated spaces, and washing your hands often. And finally, to your many questions about which vaccine is better and has lesser chances of you testing positive after, there have been no studies till date comparing vaccines, and there is no point trying to do it yourself. Most vaccines use different technologies. They were tested in different countries with different parameters in different sample groups at different points of the pandemic. All the vaccines we have are more than 50% effective, all variants considered, which is the WHO threshold for a COVID-19 vaccine. This is to say that the best vaccine is the one that is available to you. Starting May 1, all Indians above the age of 18 are eligible to get vaccinated after paying for it. So please plan for it and get your shots as soon as you can. That's me for today. I hope this video cleared some of your doubts about vaccines. If it did, please share it on your feeds with your friends and family. Each vaccinated person takes us closer to the life we all long to go back to. If you've been listening, thank you so much for your time.